What's up guys, it's Max and today I want to talk about vitamin D and COVID-19. COVID-19 is, as you know, a very new and dynamic field and many things are unclear. So before I get to the part that might be confusing, let's start with some reliable data. First, I want to point out that most of the information I use comes from Professor Smolik's blog, which is great for everybody interested in nutrition. It's in German though, so for everybody who speaks German, check it out. It's a great resource of information. Fact number 1. The physiological effect of vitamin D on the immune system is very well known. The vitamin D receptor is expressed in most cell types and may activate somewhere between 200 and 500 genes, many related to the immune system. Besides, scientists have been able to show an antiviral effect of vitamin D in lung tissue. So it's very clear that vitamin D stimulates the immune system in a positive way. Fact number 2. There is a correlation between the increase of viral diseases in winter and a particular low vitamin D level during that season. It's only a correlation, it's no causality, but it might be that viral diseases increase in winter because of a low vitamin D level. Fact number 3. Several meta-analyses show that vitamin D supplementation only makes sense when there has already been a vitamin deficiency. People who already have a good vitamin D status don't benefit from supplementation. The point is, most people have a deficiency. The German Robert Koch Institute reports that during winter, more than 50% of the population have a deficiency. All that is nice to know. But what about vitamin D and COVID-19? Studies show that critical ill patients are more likely to have a deficiency than the average population or asymptomatic patients. The problem is here that the vitamin D status was measured at day of admission to the hospital. It is known that an acute and severe infection causes the vitamin D status to drop. That means the low values are therefore not necessarily the cause of the disease, but the disease could be the cause of the low values. Another problem is that diseases that influence the course of disease go hand in hand with a low vitamin D status, which means a severe case might be caused by comorbidities, not by the vitamin D status. And that is what some studies show. If disruptive factors like comorbidities get eliminated, the correlation between vitamin D status and cause of disease disappears. On the other hand, there are studies where the vitamin D status has been measured long before onset of disease, and they have been able to show that chronically low vitamin D levels have been linked to severity of disease. So what now? I think it is clear to say that the data available is unclear. So does it make sense to say there's no harm in trying? Let's just supplement it anyways in advance? Well, you can, especially right now, because lockdowns decrease the level of vitamin D, although I wouldn't measure it out over 4,000 international units, because that could be toxic then, and since you're taking vitamin D to support your health, it shouldn't harm you. That means the dose of supplementation should be dependent on your blood values. In general, should be between 800 to 3,000 international units per day. Best is vitamin D3 or D2. And in the end, the most important risk factors for severe COVID-19 course are, besides age, obesity, hypertension, type 2 diabetes mellitus, and metabolic syndrome. It means a healthy nutrition and lifestyle besides the supplementation of vitamin D is extremely important and even more effective than just the supplementation of any vitamin. I hope you learned something new. If you like what you saw, I can tell you there's more of it where you found it. Subscribe and leave a like and catch up next time. Thank you for watching.